In the grips of the cost of living crisis, most South Africans are looking for ways to tighten their belts. And they're cutting spending in all areas of life. But sacrificing healthcare cover is really not a good option. Let's discuss this now with the CEO of Profmed, Comrie, who joins us virtually. Craig, thank you so much for your time this morning. You cannot have a conversation either in your place of work, anecdotally outside, when you're putting in petrol, buying a coffee, at home, on your stoop, in the kitchen. Everybody's talking about where can we tighten our belts? What are we doing just to try and make those rands stretch further than they have for a very, very long time? Is it worrying for you that one of the things that families and individuals are looking at cutting is the cover that they've been paying for health?
Yes, absolutely. The issue about healthcare is that it's, other than your bond or maybe your installment on your car, it's probably the next biggest expense in your home costs. So what you want to be doing is making sure that you have the right coverage. And typically people step out of healthcare cover and only return when they have something like a dread disease or a chronic disease that they need to pay for. Worldwide research actually indicates that paying for the health care of a loved one is one of the main reasons people become bankrupt. And so we urge consumers to keep their healthcare coverage. A matter of pre-funding or paying your premiums every month actually helps you to cover the bills in 2 or 3 years' time when you are faced with a healthcare emergency.
What are you seeing on the ground, though? Are you already picking up that these are the kinds of things people are cutting? Are they cutting a full spectrum coverage and then perhaps looking at hospital cover and that kind? Are these the kind of changes people are making? Or are there those that are just deciding, that's it, I'm cutting everything and just keeping fingers crossed that nothing serious happens to me or my family?
Look, I think the unemployment rate drives the latter part of your statement, is the fact that when you don't have employment, you'll cut everything and you can't afford anything. And so employment has a key part to the conversation. But for those that are employed, the most important thing is to maintain your premiums. Many people are buying down, and we've seen typically people buy down from very comprehensive cover to very little cover, and only find out that the cover isn't sufficient when they need it most. So we see a lot of the younger population buying typically what we see coming about the health insurance products that provide you with a little bit of primary care, but they certainly don't cover you extensively for those big hospital items either.
Is this also opening the door to people perhaps being taken for a ride by some types of medical aid cover that's being offered that perhaps probably looks too good to be true and probably is? Or are we seeing that could perhaps be a danger at these desperate times as well?
I think the assurance for those that are covered by medical schemes is that we have a very active regulator in terms of making sure that it's a very highly regulated market. So there is a prescribed minimum set of benefits that all medical schemes have to comply with. And there's lots of regulation and checking that actually happens. Whilst there is the emergence of the health insurance products, which is less regulated and effectively covers a far smaller group of benefits for members. And the difference in motives is also quite clear. Medical schemes are owned by the members themselves. So if you're a member of medical schemes, you own the scheme. While the health insurance products, these are profit-making entities. And so that's where the regulation needs to step in. And so as medical schemes, we've come in and requested that the regulator makes sure that the playing fields are equal and that the consumers are protected across both products.
Have you also seen that those, your colleagues, perhaps those in your field, have realized that they need to be a little bit more flexible in meeting the needs that people currently face? Because, you know, people often complain that, oh, you know, these packages that you sign up for are so rigid and they don't understand that you're dealing with the human element, and people go through different times, but they still need to know that they're getting their values worth. And indeed, when they need these medical aid schemes the most, that it will be there for them. Are you seeing some kind of flexibility and understanding from your sector at these times?
Certainly, I think medical schemes during periods of COVID and even subsequent are trying to create products that are more affordable for members of or healthcare consumers in general. We do have quite a rigid regulatory environment, and so we have requested since the late 2000s already for a low cost and a more affordable framework to come through so that medical schemes can compete in reductions of benefits, so the small effective benefits that people can afford. Our estimation is that there are probably more than 2 million people that can actually afford to pay premiums out of their pocket and become part of medical schemes, but it has to be a smaller set of benefits, and that the medical schemes regulator has to assist with. And so the framework still isn't complete, and there's lots of movements to get that right at the moment, but medical schemes must become more affordable, there's no doubt.
Just one final question before I let you go, because I have run out of time, but I must ask you this almost off-topic question before I let you go. The latest development in your sector, of course, the news coming through, the adoption of the National Health Insurance Bill by Parliament's Portfolio Committee on Health, the next step in a very long process, still lots of questions to be asked. Just your reaction from your organisation's point of view.
Yeah, we've seen the Health Portfolio Committee pass the bill, and it has gone through, and it will go through to another set of legislators before it is finally before the President. I think we are unhappy that the Health Portfolio Committee hasn't considered all the submissions from the private sector, specifically around the role of medical schemes. And so we still think in a universal coverage agenda that medical schemes still need to play a major role. As a leader within Profmed, we look after many of the doctors and specialists in the marketplace, and things like the insecurity about medical schemes into the future or funding of their claims into the future means that we've seen larger amounts of doctors and specialists immigrate. And so we need a retention plan to be put in place to keep those doctors and specialists here while we muddle through an NHI policy which isn't complete or isn't well written and needs more debate and needs to consider the impact on the private sector.
Okay, thank you so much for answering that. That is the CEO of Profmed, Comrie, joining us virtually from here in Johannesburg. We thank him so much for his time and his insight this morning.